Hey, my name is Ben. I'm a P4 pharmacy student at Auburn, and I'll be talking with you today about total parenteral nutrition, or TPN. So, an important consideration with TPN is the amount of fluids you're giving. When babies are first born, they consist mainly of water and they have a much lower body fat than adults and children. So, it's important to maintain these fluids. They generally lose 10% of their body weight within the first few days of birth and then regain that within the next week or so. So at birth, the general fluid requirements are 60 to 70 milliliters per kg per day, with an average fluid goal of 120 to 150 milliliters per kilogram per day. If the baby has an extremely low birth weight, the fluid goal is much higher at 170 to 180 milliliters per kilogram per day. You want to be careful when adding fluids too quickly in babies, primarily because you could exacerbate pre-existing conditions such as bronchopulmonary dysplasia, congenital heart defects, or heart failure. Another topic in relation to TPN is calorie requirements. So the calorie requirements for preterm and term are a little different. For preterm, it's 90 to 120 kilocalories per kilogram per day. And you're hoping for them to regain their birth weight by day 14 with their weight gain goal of 15 to 18 grams per kilogram per day. The calories requirements are a little lower for term babies just because they're more developed, with that being 80 to 100 kilocalories per kilogram. And then the weight goal is different for them. Instead, you're looking at 15 to 30 grams per day. So one main component of the TPN is the carbohydrates, or in this case, dextrose. So this should account for 40 to 50% of your total calories, and it generally ranges from 10 to 15%. In terms of calories, 1 gram of carbohydrates is equal to 3.4 kilocalories. When you're looking at dextrose in a TPN, the main factor we use to look at it is glucose infusion rate, and that is essentially the rate that you're putting the glucose in the TPN. So our initial goal for that is 3 to 5 milligrams per kilogram per minute. We can titrate that up 2 to 3 milligrams per kilogram per minute up to a maximum of 10 to 12 milligrams per kilogram per minute. It's important to take into account maintaining a goal blood glucose level. So you want to make sure that they don't become hyperglycemic, which in this case would be over 150 milligrams per deciliter, because this could potentially increase patients' risk for certain diseases like intraventricular hemorrhage, infections, and necrotizing enterocolitis. So how do we do that? There's two different components to the GIR. So you can either alter the rate or the concentration. If you look at the formula below, this is how the GIR is calculated. So if, for example, if a patient is hyperglycemic, you can decrease the rate or you can decrease the percent of the dextrose, and that should help to lower their blood glucose level. Another component of TPN is protein, or more specifically, amino acids. These are very important, especially in preterm for growth. A goal for us would be 3 to 4 grams per kilogram per day. In terms of calories, 1 gram of amino acids would be 4 kilocalories. Now, there are specific products that you can put in the TPN, the brand names being Trophamine, Premisol, and Aminosin. These contain essential amino acids that are important for growth and development, like arginine, tyrosine, and tyrine. The most important things to monitor for these are BUN level, because amino acids have a nitrogen component, so this will give you a good gauge of whether those are meeting their requirements, and then renal function, because there is amino acid filtration in the kidneys. The next main component with TPN are lipids, or intravenous fat emulsions. They're generally soy-based, with the primary fatty acids being omega-6. They're a lot more calorie dense than the other components we talked about. So 1 gram will be 9 kilocalories. There's different concentrations, so you can get them in 10, 20, or 30%. Generally 20% is preferred because there's less phospholipids than the 10%, and then a 30% would only be used in a 3-in-1 TPN, which we'll go into a little later. You initially want to start the lipids at 0.5 to 1 grams per kilogram per day with an end goal of 3 grams per kilogram. And with that, you want to make sure to monitor triglycerides, as this is a component of lipid breakdown. Continue, there is a different type of emulsion you can give. This is omegavin. So as I talked about previously, most of the component in that one formulation was omega-6. This is omega-3, so it's a little different. This is generally used for parenteral nutrition-associated liver disease. And what this does is it helps to restore the function in the short bowel, and improves bile flow, decreases bilirubin, and helps reverse cholestasis that might be associated with prolonged TPN usage. Another component in a TPN are the electrolytes. So the specific ones that are important are sodium, potassium, calcium, phosphorus, and magnesium. The requirements are different for preterm and term neonates. So you just want to be looking at their labs as well. An important consideration is their kidney function. So certain electrolytes like potassium and phosphorus are filtered through the kidneys. So you want to make sure that you're monitoring the renal function to make sure they are getting the appropriate levels of those electrolytes. Especially in neonates, it's important to look at calcium and phosphorus because these are crucial for bone growth and heart function early on. Bone mineralization doesn't occur until the 3rd trimester, so if babies are born preterm, it's important we add calcium and phosphorus to the TPN to account for that. Additionally, in terms of formulations, calcium gluconate is preferred over calcium chloride because it's less likely to precipitate with phosphate. And then in terms of acid-base balance, we can adjust that in the TPN with sodium acetate or chloride and potassium acetate or chloride. With frequency in electrolytes, it's important to monitor them at least 1 to 2 times weekly, and even more frequently if need be. Another element to TPNs are trace elements. These are especially important for enzymatic activity. Some of them include selenium. So a deficiency in that, it could result in thyroid issues and cardiomyopathy. Zinc is another important component. This is especially important for the immune system, and it'll help with healing as well. If you are deficient in this, you could have things like alopecia, growth problems, and skin rash. And then chromium helps with, it works as an insulin regulator, which if a baby is deficient in that, it could lead to glucose intolerance. All 3 of these are excreted renally, so it's important to monitor renal function with these. Some more trace elements that are in a TPN. It's copper. So this is important because it helps with liver, bone, and muscles. If you have deficits in this, you could have diarrhea. And then in terms of toxicity, it is important to look at anemia. For manganese, a deficiency in this could lead to glucose intolerance and bone issues. And then too much manganese could actually lead to neurological problems. Both of these elements are excreted by the liver, so it's important to look at liver function, and they can be used in combo products, so they don't have to be micromanaged as much. Some of these include Neotrace and Pediatrace. Cysteine is an essential amino acid that can be added to a TPN. This is a precursor of glutathione, which is an antioxidant in the body, and taurine, which helps with eyes, brain, liver, and intestine. Additional benefit of cysteine is it decreases the pH, which helps to improve the calcium and phosphorus solubility in our TPN so they don't precipitate out. Some additives that can be included in a TPN include carnitine. This is crucial for fatty acid metabolism, and a deficiency in this could result in hypertriglyceridemia, cardiac issues, and muscle weakness. You can also supplement multivitamins in the TPN, and especially in a central line, it's important to include heparin to prevent clotting. You can try to add H2 receptor antagonists, but there is an increased risk of necrotizing enterocolitis, so Aspen does not recommend this in a TPN. So with TPN, there are also complications that can arise. As I mentioned before, you can have the parenteral liver disease, or PNALD. This happens in 40 to 60% of neonates on long term, and how it generally manifests itself is through elevated direct bilirubin or elevated LFTs. So what's a good way to prevent this? You want to try to start enteral nutrition and start working that GI tract as quick as you can. Also, with lipids, you can decrease the dose and frequency. And then we can, as I mentioned previously, you can also use omegavin, which has been shown to help with the liver disease over time. Another complication, and in terms of medication management, you could also utilize your Sodiol or Actigol as well. In terms of another complication, infections can be a problem, especially with central lines. So you could have infection with certain organisms like Staph aureus, Enterococci, and Candida. What is generally recommended for this is to remove the line, and then ethanol locks can be utilized as well. Continue with more complications that can occur. So we kind of talked earlier before about calcium and phosphorus solubility. There is a limit to how much you can put in there because of that. So on the other hand, you want to make sure that they're adequately supplemented on this, because a deficit could cause osteopenia and metabolic bone disease. So you want to try to optimize this as best you can. And additionally, you could add vitamin D, which will help with the calcium absorption and with bone growth. One other complication is aluminum toxicity. So this is a contaminant that can be found in some of the elements that you add to the TPN, and it generally occurs during the manufacturing process. So we want to try to limit this as much as we can. The FDA recommends 5 micrograms per kilogram per day. And an increase in this toxicity could result in CNS issues, bone disease, and even renal impairment. So how do we remedy this or try to prevent this? Well, you can use plastic containers, which contain less aluminum than glass containers would. Try to alternate your stock bottles or your IV bags to try to prevent, if one is contaminated, try to prevent that from being used all the time. And then just using products with less aluminum. So we want to use sodium phosphate over K-phosphate. And then in preparations, so there's a pre-made preparation, sometimes referred to as vanilla. This is a temporary TPN that provides the main components that are needed, so dextrose, amino acids, and calcium. And this is important because you want to make sure that you are giving a neonate nutrition during the first couple days of life, especially with a low birth weight. It's been shown to help with weight gain and neurodevelopment. And then 2 different preparations that you can make. You have a 3-in-1 and a 2-in-1. So a 2-in-1 contains dextrose and amino acids. This is generally preferred over the 3-in-1, which includes dextrose, amino acids, and lipids, because the 2-in-1 has better calcium and phosphorus solubility. That's because the lipids actually increase the pH. And then in terms of precipitation, the 3-in-1 is opaque, so you can't see through it. And if it were to precipitate, you wouldn't be able to see the precipitation occurring. For administration, you can basically administer it through either peripheral or central line. However, for the peripheral line, there are limitations on that. So you'll have to limit your osmolarity to 900 milliosmoles per liter. And then you'll have to limit your dextrose percent to 12.5. And you should not give more than 40 milliequivalents per liter of potassium. If you do need to go above those requirements, you should put a central line in. And then there's a light exposure. So oxidation can occur when TPN is exposed to light. So this generally happens with the multivitamins and the fat emulsions. And what happens is when these are oxidized, it's hard for the newborns to eliminate them. And this could actually lead to hyperglycemia and hypertriglyceridemia. Additionally, a lot of these babies are on phototherapy as well for bilirubin problems. So that can also increase the oxidation risk. So the best thing to do is try to protect it from light as best you can. And that's it. Thank you.